You're listening to the Health Academy on Health Professional Radio, a regular listen into what's happening in the world of research and academia. Today my guest is Dr. Delaney Skerrett. Delaney is a research fellow and clinical interviewer from the Australian Institute for Suicide Research and Prevention at Griffith University in Australia. Delaney, welcome to Health Professional Radio.
Thank you very much. Thanks for having me.
Now, Delaney, give us a little insight into your research here. What have you been working on?
Okay, well, we've just actually finished a study that was funded by Beyond Blue, and that was to look at fatal suicidal behaviours, so that's death by suicide, in LGBT people in Australia. There's been quite a bit of research done in the area of the non-fatal behaviours with so people who thoughts about suicide or suicide attempts in LGBT people in Australia, but this is the first large-scale project that had ever been done in the area of actual suicide death in LGBT people in Australia, and so that's what I've been working on for the past couple of years, and as I say, it's a project that we've just got through to completion.
Now, I guess the obvious question for me here is if you're dealing with fatal suicides, what's the research methodology? How do you go about doing that?
So there were two components to it. So the first part was looking at the QSR, which is the Queensland Suicide Register. So that's a database of all suicides that have occurred in Queensland since 1990, and it's maintained by the institute that I work at here at Griffith University. And so it's basically compiled from information that's provided by the Queensland Police Service and the coroner, as I say, of all suicides that occur in Queensland. And so we had a look at 10 years worth of data out of the register to see how many of the cases in there that we could identify as being LGBT or even LGBTI. But the problem there is that data about sexuality or gender are not routinely collected on death by suicide, and so it's not like there's a box that's ticked that says, this person identified as gay or they were transgender. We just had to look for information within the cases to try and identify as many people as we could that were LGBT. So that was the first component. We looked at 10 years worth of data there, and out of that we only, and I say only in inverted commas, we were able to find 35 cases, and which would appear to be low given that, in 10 years' time in Queensland you have around 6,000 suicides. So it would seem to be a case of underreporting, that you would expect there to be more than that with LGBT people. But as I say, the data aren't routinely collected. But we were still able to look at those cases and see if they were any different to the non-LGBT cases. So that was the first thing that we did. And then the second was interviewing people who knew an LGBT person that had died by suicide. So someone that was close to them that identified as LGBT. And that is called that particular type of interview is called a psychological autopsy. So it goes through basically the life of the person that had died and trying to find out all the factors that might have been related to the suicide death in that person. And in that part of the study, we compared the people who died by suicide with living LGBT people. So the first component, we compared the suicide death cases of LGBT people with non-LGBT people from the register and compared the factors related. And the second part, we compared LGBT people that had died with living LGBT people.
Now, Delaney, were there results that came out of this that you're able to share with us?
Sure. So in the first component where we compared LGBT people with non-LGBT, the most significant finding there, in terms, when I say significant, I mean in terms of statistical significance, that the difference was the largest, and in factors that surrounded the suicide cases, was in terms of relationship conflict. So that in the case of LGBT people, there was a much greater incidence of there being conflict in relationships in the period leading up to the suicide. There was also a higher incidence of depression in the case for LGBT people there. But certainly the strongest result that we found, where the difference was largest, was in that issue surrounding relationships. And in the second component, there we, as well as comparing the living people with the people that died, we actually also mapped out the lives of the people that had died to see if there were certain patterns that were recurring. And one thing that was very striking was that issue of relationship problems, particularly in the older suicides. And when I say older, they tended to sort of cluster into two age groups. There was the younger people that had died, which tended to be sort of late teens and into their 20s. And then the older group were people late 30s, early 40s. And in that older group, what was very striking there was that incidence of relationship conflict in the period leading up to the suicide death. So that confirmed the findings that we had from the Queensland Suicide Register component as well. In terms of the differences between the living LGBT people and the ones that have died in the second component, there were certainly differences in relation to mental health, as we found in the issue to do with depression in the first component, comparing the LGBT people with non-LGBT. So, for example, odds of there being a current case of major depressive disorder in the LGBT people that died were 23 times higher than they were in living LGBT people when I interviewed them. So certainly greater incidence of that. And anxiety disorders were higher, and also use of substances. So alcohol dependence as well as abuse, but just also substance use and drugs other than alcohol, and substance dependence was also higher. I was just going to mention one other thing. There was, not surprisingly, there was a difference in terms of the incidence of HIV or AIDS when we compared LGBT cases with non-LGBT cases of suicide. But what was interesting when we compared the LGBT suicide deaths with living LGBT people, there was a higher incidence of HIV AIDS in the people that had died, but it wasn't statistically significant compared with the living LGBT people. So it didn't actually emerge as a risk factor, statistically speaking, there.
Now, you did mention a number earlier from your register work. What was the number that you ended up with when you went into the interviewing process?
So in total we did 27 interviews, and then for each interview with with someone that knew an LGBT person, we did 3 interviews with living LGBT people that were matched by age and gender or identified gender. So that's a total of 81 control interviews and 27 psychological autopsy interviews. And that's a significant piece of research to do. Has your research finished now? That particular component has finished, or that particular project that was funded by Beyond Blue. There's still certainly an outstanding need for more research into suicidal behaviours in LGBT people in Australia. And even though I said earlier on in the interview that there's been a significant amount of research done into the non-fatal behaviours, there is still a need for more research with living LGBT people about suicidal behaviours and thoughts about suicide attempts, because we need to understand better that trajectory, that pathway that leads to the development of suicidal behaviours in LGBT people, and to understand how it's different, or how it might be different to non-LGBT people. And of course, when you're able to actually speak to people who are alive, and you're able to get the information firsthand from them, the data tend to be more reliable in that case. So it's always a limitation of doing research on the fatal behaviours, is that you're interviewing people who knew the person, and it's second-hand information in a way in that sense. So it would certainly be good to be able to do more research, large-scale research, with living LGBT people, to understand that process of that leads to suicidal behaviours in them better.
And are you planning to undertake that research now?
There was a plan where we were looking for funding for that, but at this point we haven't been successful in being able to get that funding. So obviously in academic work, the funding does need to be able to come from somewhere to be able to pay for it. So it's something that we've been looking at, but as I say, at the moment the funding has been limited, or at least for that particular project we haven't been successful in getting anything. And
if it is funded, do you anticipate what the benefits might be of that further research? Is it research that you expect will have some real world impacts, or will it be an academic knowledge outcome?
Oh no, certainly it has immediate application to the real world and being able to inform intervention strategies for suicidal behaviours in LGBT people and also prevention. So what we're looking at there is ways in which we can, if we understand better pathways and trajectories to suicidal behaviours in LGBT people and how they might be different and what's specific about them, we can set up ways in order to prevent those behaviours from occurring, or, as I say, if they're already occurring, what are the best types of interventions that we can have. So we already do understand a bit better ways that perhaps we can prevent suicidal behaviours from the research that we've done, because we can see that one of the other issues that emerged in the second component where we compared those that had died with living LGBT people, that there was a significantly higher incidence of internalized homophobia and internalized shame in the people that had died, and a lack of acceptance from family, particularly in the younger group. So I mentioned they were sort of older and younger. So we know that is still an issue, even though society believe is more accepting nowadays around sexuality and gender, but the things are still leading to suicide based on the results of this research. So that has implications for prevention. It means that we still need to work on having a society that's more tolerant and that there's less stigma around diversity in sexuality and gender. You know, that's an immediate implication that comes from research like this. And then with the further research, where we're able to further and better understand the pathways to suicidal behaviours by doing research with living people, then we can also tailor, as I say, intervention strategies more effectively for those people by understanding what it is that they're going through, what are the things that have led to that, but also to understand what might be the barriers to help seeking with those people, because that's another issue that emerges from this type of research, that LGBT people, and not just from research that we've done, but other research that's out there, and particularly in the Australian context, that one of the reasons that LGBT people might not be getting help for mental health problems and issues around suicidal behaviours is either the experience or the belief that mainstream mental health services are not going to be inclusive of diversity around sexuality and gender. So those are the kinds of things that can be informed by doing further large-scale research with living people.
Well, we certainly hope that, having completed a significant study to date, that the funding does become available for you to complete that work and continue your research. Delaney, it's been a pleasure having you on today, and thank you for your time. I understand that there's further information available online at www.griffiths.edu.au/AISRAP, AISRAP.
Yes, that's right. That's the website for the Institute here.
You've been listening to the Health Academy with Wayne Buckler on Health Professional Radio. If you've just tuned in and you'd like to know more, there's a transcript of my interview with Dr. Delaney Skerrett on our website, and also in SoundCloud and YouTube for an audio archive. Our website's www.hpr.fm. You're listening to Health Professional Radio.